It's a good mix from, learning a lot to sometimes a little bit routine. Sometimes it's a little bit chaotic, but then we also like to offset that by, taking it easy, sometimes having a little bit of fun. Because we're kind of a close-knit office, and I've worked at places that were larger, corporate. We're a very tight team. We like to all get along, and we look for people that also we think will mesh well with us. We like to encourage, team outings from time to time, whether that's, going to a restaurant or getting a drink together on occasion. I think the office flows best, both from, behind the scenes and then as a patient when, everyone is helping each other out. Sometimes we need you to jump in and help assist a patient, take a phone call, help them to their seat, something like that. And luckily our team also really works well together and is willing to do that kind of thing. And it depends as to, what role they're applying to, whether that's to be working in the front with insurance or directly with patients explaining treatment, or are they looking to be a hygienist or a dental assistant. There's various room for growth there. The nice thing is that dental aesthetics is constantly expanding, looking to expand into another office, building out another team. And so looking for team leaders, people looking to expand their role. I would hope that they would come, prepared to learn something new. Even if they're experienced in the field of dentistry or hygiene, there's always something a little bit different about each office, and someone who's flexible or willing to change things up is very good. We pride ourselves on having modern technology, that kind of level of innovation. So that means, changing the way that things used to be done occasionally, or speaking with representatives, people, high up in their field, and learning from their experience, taking their expertise into practice. I would say attitude and personality is everything. Experience helps, absolutely. Having that knowledge is definitely important and will come in handy. But the number one thing that I look for is someone that is a hard worker, is coming prepared to learn, who understands their strengths and their weaknesses, areas where they might not feel so comfortable, and be prepared to address them and to learn and then apply that moving forward. A good attitude, team player, someone who understands maybe what the experience of being a patient is like, and who can act accordingly, treat the patient with respect, of course, but empathy, really. That's the number one thing that I'm looking for as an employee. So if you feel that you have that, even if you don't have all the experience that's listed, I think you should apply.